We are providing an in-depth look at the current status of the COVID-19 pandemic as it makes an unexpected comeback in late 2024. With new variants driving infections and public health responses evolving, it's clear that the virus remains a significant global health challenge. As we head toward winter, experts are urging renewed caution, focusing on vaccines, preventive measures, and an understanding of the changing virus. COVID-19 is once again spreading across multiple regions, fueled by new and highly transmissible strains, particularly those from the FLiRT variant family, including the KP.2 and KP.3 subvariants. These mutations have demonstrated a greater ability to spread than previous strains, resulting in a significant rise in cases during the typically lower-risk summer months. Wastewater surveillance data from regions across the world indicate that virus levels are considerably higher than reported figures, with some estimates suggesting 2 to 20 times more virus circulating than detected by traditional methods. The uptick in infections has been particularly noticeable in the Americas, Europe, and the Pacific, where emergency room visits and COVID-related hospitalizations have been climbing, albeit at a slower pace than during earlier waves of the pandemic. Despite the rise in cases, there is a silver lining: hospitalizations and severe outcomes have not spiked as sharply as in the past. This is largely due to widespread exposure to the virus over the past few years, coupled with ongoing vaccination efforts that continue to provide protection against severe illness. However, with the virus constantly mutating, experts remain vigilant and concerned about potential future variants that could evade immunity altogether. To combat the evolving virus, updated COVID-19 vaccines have been developed and are now available for the 2024-2025 season. These vaccines, produced by Moderna and Pfizer, target the KP.2 variant, which has become dominant in many parts of the world. In addition to these mRNA vaccines, Novavax's protein-based alternative provides another option for individuals who may be hesitant about mRNA technology. All of these vaccines have been shown to significantly reduce the risk of severe illness and hospitalization, though they may not fully prevent infection. Health authorities recommend that everyone aged 6 months and older receive the updated vaccine, with special attention to high-risk populations, including the elderly and immunocompromised individuals. Protection from the updated vaccine peaks around 4 weeks after administration and lasts for several months, making it essential to get vaccinated before the colder months set in, when respiratory viruses typically become more widespread. If you've had COVID-19 recently, the Centers for Disease Control and Prevention, CDC, advise waiting at least 3 months after infection before receiving the new vaccine. This allows for optimal immunity and reduces the likelihood of a severe infection from the circulating variants. As COVID-19 infections rise, the importance of preventive measures like masking and testing has resurfaced. Health officials are once again recommending the use of well-fitted masks, especially in crowded indoor environments where the risk of transmission is higher. N95 or KN95 masks are particularly effective at reducing exposure to the virus, and individuals at higher risk for severe illness should consider wearing masks in public spaces. Testing remains a crucial tool in controlling the virus's spread. Rapid over-the-counter tests are still effective at detecting the new FLiRT variants. Experts advise testing if symptoms appear or if exposure to a confirmed case occurs. For those with negative test results but persistent symptoms, it is recommended to retest after 1 or 2 days, as it may take time for the virus to reach detectable levels. The World Health Organization, WHO, has issued a cautionary message that the pandemic is not over, and new, potentially more dangerous variants could still emerge. While hospitalizations and death rates remain relatively low, the virus's ability to mutate poses a significant threat to global health, particularly among high-risk populations. The WHO is urging governments to strengthen their vaccination campaigns and ensure that high-risk groups receive regular booster shots, ideally every 12 months. The organization has also expressed optimism about the development of nasal vaccines, which could be more effective at preventing transmission by targeting the virus at its entry point in the body. As we approach the winter months, it's critical to remain vigilant and proactive in reducing the spread of COVID-19. Vaccination remains the best defense against severe illness, and those who haven't yet received the updated vaccine are strongly encouraged to do so before the peak of the season. Masking in crowded spaces, practicing good hygiene, and staying informed about local transmission rates are also essential steps to protect both yourself and others. COVID-19 continues to evolve, and with it, our response must evolve as well. By staying informed and following expert guidance, we can minimize the impact of the virus and keep our communities safe during this challenging time. Stay safe, stay healthy, and be prepared for the months ahead. That concludes your comprehensive update on the COVID-19 resurgence. Keep watching for further developments as we navigate the coming winter season.